everyone. I'm Dr. Mathur Hanif, Assistant Editor at Medical News Pakistan, and I'm so excited to welcome you all to this live session, Prevention, the Cornerstone of Management. And I'm so thrilled to welcome our speaker, Professor Dr. Shahbaz Qureshi. He's President-elect Pakistan Aspirin Foundation. He's also Council Member of Heart Failure Council of Pakistan. He's Professor of Cardiology at Vateem Medical College. He's been formerly the Head of Department, Federal Government Postgraduate Medical Center, Islamabad, MBBS Medical College, Mirpur Khas, Azad, Jammu Kashmir, with interest in interventional cardiology, cardiac imaging, journal cardiology and diabetes. He has been published extensively in peer-reviewed international and in international journals, and has served as Vice President of Pakistan Cardiac Society in the past. Hello, Dr. Shahbaz, please join us in the video.
Thank you very much. Yeah, it's indeed a pleasure and an honor to be a part of this webinar and to make this presentation. I think lifestyle management, even in today's stressful conditions and cataclysmic times, is the best way to manage not only the cardiovascular diseases, but the COVID-19 condition that we are all facing all around us. Just a brief comments about what really is COVID-19 and how we have come to this pandemic. Now, when we look at the virus which caused it was the SARS-CoV-2 virus. Actually, it was the SARS virus in 2002, followed by the MERS in 2012. And now in the year 2019, towards the end of the year, we started to see conditions of pneumonia which could not be explained on the usual parameters. And it was felt that there is a new virus which is causing this condition. And this was a mutation of the previous coronavirus, and this was known as the SARS-CoV-2. This is new to the humans, and it is transmitted via various mechanisms. It is airborne, and it can be transmitted by touching the surfaces on which it is present. And if we touch those surfaces, or if somebody coughs near to us and we inhale it, or the virus is exposed in a way it enters into, or it gets into the eyes, the nose, and the mouth. And then from there, it impacts the lungs and the other organs. It started in Wuhan, in the Hubei province of China, where it spread like wildfire, but unfortunately at that time, it was not restricted into that area. It went beyond that and spread in the entire world. And now it has engulfed each and every country and is causing devastating results in many of those countries, like in Europe, in America, and in Pakistan. We are seeing the increasing incidence of COVID-19. Even in the other places in Southeast Asia, we have a similar incidence to our incidence, even though we have the lesser amount of fatalities which are present. And it is being postulated that it may be a result of maybe some kind of a vaccination we have had in the past. But in Pakistan, unfortunately, there is very little documentation about the deaths which take place and the diagnosis which is attached to it. So I think in a way, it is not the right representation of what is happening. And it is not willful. It is unfortunately a result of our ages-old system where we have no documentation. Now, why is it dangerous? You see, the thing is that COVID-19 is a highly infectious condition. And when it is transmitted to people, it can result in very devastating consequences in some of them. 80% of the patients may not have any problems, maybe just having some light, mild kind of symptoms, and they may recover on their own. Another 10 to 15% become serious, and another 5% become critical, and they go on to ventilators. And unfortunately, those who are on ventilators, they usually, there's about 80% mortality in such instance, in such cases. Unfortunately, there is no immunity in these patients. And some of the people, as I said earlier on, they get very sick, and 25% of them require intubation and ventilator. Now, there must be a group of patients who are more at risk. It cannot affect everybody in the same way. And also, it can have more serious consequences in some people. And who are those high-risk individuals? If we look here, we will see that the high-risk individuals are those who actually will be having a 2 to 6 times the risk of getting COVID. And who are they? Those who are in the elderly age, those who are hypertensive, those who have cardiovascular disease, diabetic patients, obese patients, those with chronic lung conditions. Also those patients who are smokers. Smokers are more prone to develop COVID-19. And it is my message to everybody, especially the smokers, that they should quit smoking so that they can save themselves from becoming infected by COVID-19. Those who have cancer, they are more prone to get COVID-19. Those who are on steroids. So all such individuals should be more careful. There should be more social distancing, physical distancing. They should stop smoking. They should stop hugging each other. People should stop shaking hands with each other. They should not get together. There should not be large gatherings, because in those gatherings, the chances of people transmitting the disease and the others getting the disease, especially the elderly population. And I think it is important that what we should do is that we should be prepared for it, and we should actually keep certain things in our house. And one of them is a pulse oximeter, so that we can know the oxygen saturation, a thermometer to see the blood pressure, reusable masks for going outside, and consider wearing glasses whenever you go out so that you can protect your eyes, and a blood pressure cuff. So I think that there are certain minimal requirements which you should have. Whenever we are preparing for a war, we should be prepared to confront it. And I think these are the minimal requirements that we should have. And then there are certain do's and don'ts that we should follow so that we can avoid COVID-19. This is the condition. We do not know the enemy. The enemy is totally unknown to us. And as a result, we cannot take any precautions, or cannot take drugs. They are not there. We cannot have vaccination. It is not still there. So the best way is to avoid it. It is not that you should not be scared of it, that you should go and meet it head on. No, I think we should make all efforts to avoid it, to protect ourselves. When we talk about preventive cardiology management in the COVID era, because the era in which we are living today should be designated as the COVID-19 era, there should be no change as far as prevention is concerned. We should still eat healthy. We should still exercise at home. All of us who have to take medicines, who have cardiac conditions, who are diabetic, who have other conditions, comorbid conditions, they should take their medicines. And we should monitor the blood pressure, that this is under control. And then what we need to do is that we should still be in contact with the patients, but probably through video contacts, through telephonic contacts, through telemedicine. And then we can delay the normal lab work that normally patients go and get their blood test done. And we should have a shift in our philosophy in dealing with our condition. It should be from optimizing the risk to a stable regimen. We should actually, what we should be doing is that we should be stable as far as our medical condition is concerned, so that we don't have to rush to the hospitals to get emergency treatment. What really should I do about medical care? This is a question which is invariably asked. More people are dying at home, actually, because of COVID-19 and also of non-COVID-19. Unfortunately, patients who are sick, who have cardiac conditions, they are afraid to go to the hospitals because they feel that they might contract COVID-19. So it is very important that we should still be concerned about our other medical conditions and should understand that certain hospitals, or should actually find out what hospitals are open so that we can contact them for our conditions. And remember that cardiac care in certain hospitals has not stopped. It's not stopped the world over. It has not stopped in Pakistan. So anybody who gets a chest pain and considers or thinks that it is a heart problem should get to a place where it is specified for cardiac conditions so that they can get the best possible management. And for the routine care, like for example, if a patient calls me and says that I have been taking your medicine for the last 1 month or 2 months, should I continue with that? And I think for that routine care, you need televisits. And you can even have you can delay the live visits until safety measures are in place. And in case, for God forbid, patients have symptoms, they should call their doctors or go to the emergency department. So the important thing is that during this period, we should all relax and enjoy this time, sleep, and remember, this is a very stressful condition. This is a very cataclysmic time, but as we all say, the show must go on. And we should develop other hobbies, other interests, which we can engage in our home so that we keep ourselves busy. Now, coming to the lifestyle management and prevention of cardiovascular diseases, I'm going to talk about it in these 5 different topics: the massive interventions, quitting smoking, adopting a healthier diet, and being physically active. And then I'm going to wrap it up. Let us see the massive interventions that have taken place in the past. When Poland was in transition from a communist state and into a more democratic area, then what was seen was that as the price of butter, which was no more subsidized, increased, less of it was being used, and more of vegetable fats and oils were used. At the same time, you see, initially, there was an increase in the cardiovascular diseases, both in men and women. At this point in time, where there was a reduction in the use of butter, there was a reduction in the incidence of cardiovascular diseases. So that means that if you have an intervention at this level, there will be a reduction in cardiovascular diseases. It was again seen in another country during the economic crisis in Cuba. what was seen was that when there was a crisis of gasoline, people started walking more. And as a result, also, because of the crisis, the number of calories were reduced. They were nearly halved. This was the best calories a person can take every day. And as a result, the prevalence of obesity from 12% was reduced to nearly 6%. It was halved. So just look at this, that with a reduction in the incidence, in the ingestion of calories, with more walking or exercise as a result of inability to take the transport or cars because of the increased price of gasoline, there was also a reduction in the prevalence of smoking in these individuals. Now, as a result of the Cuban economic crisis, what happened? And you can see here that there were effects either in the decrease in mortality, if I asked you these questions, a decrease in cardiovascular events, a decrease in diabetes, and a decrease in cancer. The answer mostly is that there was a decrease in cardiovascular events. And this is exactly what happened. Here, when you look at the Cuban crisis, at the peak of it, there was a reduction in diabetes, there was a reduction in coronary heart disease, cancer did not make much of a difference, and the all-cause mortality reduced. But as the crisis improved, you will see that there was again an increasing incidence of diabetes, of coronary heart disease, and of an increase in the all-cause mortality. The message which I take from here is that in countries when you have such crises, and Pakistan is facing a crisis, an economic crisis. We are facing the crisis of COVID-19. Perhaps if we reduce the intake of calories, if we reduce the intake of fats in our diet, we are bound to reduce the incidence of diabetes, obesity, coronary heart disease, and all-cause mortality. Now, the recommendation given to promoting of a healthy lifestyle at the population level is a 2A, and it should be considered. What about quitting smoking? To describe this slide, what I'll tell you is that if a patient has a high cholesterol, has a high blood pressure, and is smoking, I do not tamper with the cholesterol. I only control his blood pressure, and I ask him to quit smoking. By just quitting smoking, this patient will reduce the chances of developing cardiovascular diseases by 50%. So what should be the result of quitting smoking? What are the consequences? People normally, when I ask them, please don't smoke, they start saying that my weight will go up and I will not, and because of that, I'll have more problems. So what are the consequences? Is it by quitting smoking, you have an increased weight? Is there a quick reduction of cardiovascular disease, a slow reduction of cardiovascular disease, or a no reduction of cardiovascular disease because of the weight gain? And the result is that there is a quick reduction of cardiovascular disease and slightly a slow reduction of cardiovascular disease. That is the most important thing as the result of quitting smoking. Now, and a meta-analysis in these 25 cohorts where 503,000 patients, participants were examined for cardiovascular mortality who were smokers. And when they quit smoking, you will see that there is a reduction in their hazard ratio immediately. But they come back to the level where they were if they were not smoking, or to the level of their counterparts who had never smoked. It will take them about 10, 20 years. Immediately, there's definitely a benefit of quitting smoking. Then let us look at the cardiovascular mortality and the pooled estimate in another group of three cohorts of patients and 170,000 participants. You will see that when they stopped smoking, it is reduced. There is the hazard ratio of death from cardiovascular diseases is reduced. And then there's a slight increase again. These are the people who are the current smokers. These are the never smokers. And those who quit, this is the result. As a result of quitting smoking, initially there is a weight loss. But as with the passage of time, there may be a slight increase in weight, but it is still not very significant. So we should not worry about that. As a result of these observations, it is recommended to identify smokers and provide repeated advice on stopping with offers to help. And we can have alternate support systems like nicotine replacement therapies, varenicline, and bupropion individually or in combination. People have been using e-cigarettes now, but there is a wealth of data showing that they are not good also. So I think quitting smoking completely is the best thing. However, what really happens, and we have all seen it in our practice, that whenever people stop smoking for a short while, then they go back to it. Some of them go back to it, those who are current smokers, who are former smokers. In all these, the participants actually, it was shown in an 11-year follow-up that some of them, even though they have given it up for some time, they once again start smoking. So what we need to do is to keep on emphasizing on them that they should not go back to smoking. We should be reinforcing it. That is the most important thing. After talking about the interventions that can be done as far as the health, cardiovascular health is concerned, regards the diet, regards smoking, and I'll talk about exercise towards the end. Adopting a healthier diet is very good. And this is what has been shown in all these studies. The overall benefit of healthier diet cannot be overemphasized. And if we adopt a healthier diet, this is a controlled diet, and this is the Mediterranean diet with nuts. The total mortality is reduced here. The cumulative incidence of cardiovascular diseases is reduced. And this actually gave a 1B indication for a healthy diet, which was recommended as the cornerstone of cardiovascular disease prevention in all individuals. Now, whenever we talk to our patients and request them that they should change their dietary pattern, invariably, the answer that we get is that the taste is not good. And I remember when I was a medical officer, one of the patient, when he was being advised, he remarked that I tell my wife that towards the end of my life, she's going to kill me by giving me very simple, bland diet. So that is the diet which people cannot take actually for a long period of time. And they don't like the taste of such a very restricted diet that we advise to them. Or they may say that they don't have time. They have to run to work, so they just grab a burger, which is very bad for health. Then they don't have the willpower to adopt a healthier lifestyle. Or they feel that the healthy foods are not available for them. They are not able to get them. Now, in this study, when we looked at all these parameters of taste, time, and lack of willpower and limited options, what was seen was that in these 52,000 participants, the barriers to healthy eating invariably was taste. So what we need to do is, A, to develop a taste for simple food, for healthy diet, and even that diet can be full of flavor and it can be full of taste as well. These are the cardioprotective dietary patterns that you have. And you can see that they are not the ones which, for example, fruits, vegetables, cereals, whole grain cereals, they're all good for milk. They are good for health, and they can be easily taken. The taste is also quite acceptable. Now, what about dietary cholesterol and eggs? The American Heart Association recommends less than 300 milligram per day. Dietary cholesterol found in animal products. The major sources are egg yolk, shellfish, organ meats. These foods are relatively low in saturated fat, but I feel that you should not, maybe those who are healthy, they can take the egg yolk more frequently, but those who have cardiovascular conditions should take about 2 yolks in a week. And they should avoid organ meats as much as possible. They can eat more of skinless white meat poultry. They can choose a fish meal at least once a week. Buy fresh if food budget allows, or you can even use tuna, or you can use salmon. And you can replace the animal protein with non-meat protein sources, and they can be very tasty. Tofu, beans, legumes, hummus, peanut butter, nuts, they're all good. So I think this food here, which is shown, is very attractive. What about the oil that we use for cooking? We should actually be having the oil in a limited amount. We should be replacing the saturated fats with the unsaturated. We should have monounsaturated fats. Olive oil is very good. Extra virgin olive oil. Canola oil is very good. Olives, nuts, peanut butter, nut butters, avocado, we don't get it in Pakistan. Polyunsaturated fats, corn, sunflower, soya bean oil. All of this is very good when we are cooking our food, but the amount, it should be a limited amount. We should increase the fruits and vegetables and whole grains in our food, and our plate should be a smaller one. We should have half of it full of fruits and vegetables, and half the grains should be whole. Thoroughly, we should wash the fresh fruits and vegetables. We should avoid frozen vegetables with butter, cheese, or cream sauces and canned foods in syrup, and try to incorporate healthy foods into our snacks. This is what we should do. And I think fruits and vegetables, whole grain, cereals, they are very attractive and should be incorporated into our diet. This will actually form a very healthy diet. Now, we can actually decide what meals work for your family. We should make sure that the family looks forward to the meal. We make such a meal that they enjoy, and we should create actually a meal plan to last for 2 weeks, and always mix fresh, frozen, and shelf-stable foods. And we should keep the pantry well stocked with the grocery that we need. Now, important tips to follow during this time. For those who are elderly and they have to go and shop themselves, they should go off-peak hours. And we must always wash our hands. We should shop online where delivery or curbside pickup is available. We should contact the food distributors and check out local farmers markets or join a CSF program and visit non-traditional stores for food and household goods. My plate should be a small one, and it should have fruits, grains, vegetables, and proteins, dairy. You see, and we can always go to these sites and cook excellent food. And that would be very tasty and acceptable to us and to our patients. In fact, I think what we really need to understand is that we should be, as doctors, we need to be role models for our patients. What about physical activity now? What is good? Is it the more physical activity, the better? Only moderate to vigorous physical activity is effective? If we stop, we will lose it all? Or is it never too late to start? And I feel that I would put the emphasis here. It is never too late to start. And if you look at this, if you're physically active, you would see that as you increase your physical activity and the total METs that you are having per minute, there comes a level after which there is very little benefit, which means that you don't have to exercise for 2 to 3 hours. 45 minutes to 1 hour of vigorous exercise of about 20 minutes, moderate exercise of about 20 minutes should be good enough for you for the entire day. And this is actually what was also seen, that even light physical activity is good. Walking is good. You don't have to strain yourself too much. And the moderate to vigorous physical activity is good, is really good. And if you look at the physical, if we are physically active and we have an accelerometry which is attached to us, we can see that that also shows to us that being physically active is the most important thing, and this will reduce the all-cause mortality hazard ratio in our patient. Now, if we look at the physically active patients or the physically active society, you would see that if you are continuously inactive, then the cumulative survival is reduced. The decreased physical activity and the continually inactive are the same. Then you have the decreased physical activity, which is also better. However, the continually inactive, like this, they are the worse off, and those who are continually active, you will see that their survival is much better. And when you add to it a Mediterranean diet, you will find that the benefits multiply in these patients. So it is recommended for healthy adults of all ages to perform at least 150 minutes a week of moderate intensity or 75 minutes a week of vigorous intensity aerobic physical activity or an equivalent combination thereof. It's a 1A indication. And for additional benefits in healthy adults, a gradual increase in aerobic physical activity to 300 minutes a week of moderate intensity or 150 minutes of vigorous intensity aerobic physical activity or an equivalent combination thereof is recommended, and it's a 1A indication. During these times, when we cannot get into the gym, we can adapt ourselves to various forms of exercises, even at home. They can be done. You can do some resistance exercises. You can increase the frequency, the intensity, the repetition that can be done. We can maintain a muscular strength and a functional range of motion. And whenever we are doing exercise, let's take a break of a couple of minutes in between and then start again. And we should always avoid holding breath when we are lifting weights. Another thing which I found is very useful is to actually get into yoga exercise every day. It's a kind of a meditation also. Praying 5 times a day, excellent. Reading the Quran, very good. Yoga, another form, I think, also to be incorporated in our lifestyle will be really making our lifestyle very healthy. Then, whenever we are going out now, since we have social distancing to observe, we should wear a mask when exercising outdoors and wear a cloth. You can have actually cover your face with cloth in public settings when social distancing measures are difficult to maintain. You should try to exercise alone. Select an outdoor route that allows social distancing. You can see that I don't know if it is possible in Pakistan at the moment because most of the parks are now out of bound for everybody. But you can do it in your homes, you can do it in your driveways, you can do it in your lawns, you can even walk in your room also. So you can adjust it and you can adjust the time of day when you exercise. Mask and face coverings will restrict some airflow, making exercise more difficult. But I think once you get used to it, it is possible. Try several types of material, which especially those which are washable, you can use them for your masks as well. We have all kinds of gadgets available to us. We have those pedometers in our mobile phones to tell you how many steps you have taken. You have these watches, you can use them for all kinds of things like the heart rate that you achieve, like the amount of exercise that you have done. But this is not necessary to use them. You can do without them if you don't have them or you can't afford them. Then, what kind of exercises you can do at home? You can do skipping actually. You can do squatting. In the elderly, you can do this, the plank exercise. You can try to see how long you can stay like this, maybe 1 to 2 minutes. While sitting on the chair, keep on exercising with your legs, raising them and lowering them down. Then you can use very light weights and do exercise. You can do some push-ups as well. Or you can just climb up the stairs. That will give you some exercise. So there are actually all kinds of measures that are available to us and we can adopt them. Then if you are fond of exercising with a companion, you can do that on Skype or on FaceTime, and that will actually make it more enjoyable for you. So the alternative exercise equipment that you have, you can do the push-ups, you can put a backpack here with a little weight, that will give you good exercise. You can sit on a chair and do it. The most important thing is that don't be a couch potato. Exercise. Just get up and walk. That is good for you. Have a healthy diet. Being physically active is the most important thing. This is a picture not from the COVID-19 era. It is much earlier than that. And here also you will see that some participants are using the mask in China. So in the wrap up then, ladies and gentlemen, lifestyle has a major impact on cardiovascular disease interventions. They're hard to implement at the individual level because of lack of time. People don't have enough knowledge about it. They're not so motivated. The environment is very unfriendly. They can't move around there. But a way can be found. The most important thing, which I feel, is that it should be a multidisciplinary approach. And there should be a multidisciplinary team where you have a doctor, a nutritionist, a physical rehabilitation person, a physiotherapist who can guide you. And this is my last slide here now. When we have the recommendation, there's established cognitive behavioral strategies, motivational interviewing to facilitate lifestyle changes are recommended. It's a 1A indication. Involvement of multidisciplinary healthcare professionals, 1A indication. And in individuals at high cardiovascular disease, there are those who have had a heart attack, who are diabetic, who have other comorbid conditions. You need a multimodal intervention where you integrate the medical resources with education on lifestyle, physical activity, stress management and counseling on psychosocial risk factors, they are recommended. It's a 1A indication. So actually, a healthy lifestyle is a holistic approach in our treatment of our patients. We need to treat them for their medical condition. We need to rehabilitate them physically because if they have a good physical adaptation, they will be more confident and they'll be able to have a better quality of life when they will be participating in their responsibilities to the society, to the family. Most of our patients, they get depressed, they have anxieties. There should be a stress management and a counseling on psychosocial risk factors. So all of these are very important. So that is why the title of this talk was Lifestyle Management. Lifestyle incorporates everything. It is the cornerstone of prevention of everything. In the COVID era period, after the COVID era now, it has been there before that, and post-COVID era, it will continue to be there. So I think the emphasis should be first and foremost, before any drugs are given, lifestyle management. Thank you very much for your patient listening. And I'm now open for any question that may be put.
Yes, thank you, Dr. Mushtaba. I had this question can you advise
Sorry, Dr. Muatar,
Yes,
I'm using my son's laptop, so the
yes,
name
yes.
comes as Mushtaba Shahbaz. He's
All right.
my son. He's also a doctor, but I'm making the presentation, Shahbaz Kureshi.
Yes, sir. Sorry for the mistake. Sir, can you advise people how to make staying at home a blessing during such times?
Pardon? These are difficult times. There's no doubt about it. And the most important thing is that when we get up in the morning, these days it is even better because we are basically fasting, most of us. Those who are not fasting, when they get up in the morning, what they should do is that they should have a small paper and they should write the list of things that they want to do for the whole day. How much time they are going to spend on exercise, on how much time they're going to spend on talking to their friends and relatives, which is also very important, and how much time they're going to spend on the social media. What I feel is that you should actually spend about an hour on the social media, no more than that every day, and about an hour of exercise should be incorporated in the entire day. You can do it at home. You must exercise at home. And then the best thing is not to sit in front of a television. Avoid that. Because when you listen to all those people on the television, you get more panicky. You have more stress. So the best thing to do is to avoid that. This is the best time to read books, to increase your knowledge, to exercise, to sit with the family and enjoy your sahars and aftars with the family. Pray with more devotion, read the Holy Quran, and I'm sure that all of us, inshallah, will come out of this COVID-19 in one piece.
Dr. Shahbaz, you being a cardiologist, I had this question that is it true that females are more prone to heart disease or males are? And what is this reason behind?
I think that is very interesting because I also saw that COVID-19, actually, there are more men who are getting it. And the women are lesser in number. Now, I know of a couple who both of them had COVID-19 positive. And I was informed about it. Then I talked with them. The wife had lesser symptoms, even though she was positive. But unfortunately, she was younger also and appeared more healthier, even though she is obese. But the husband, elder to her, in his mid-70s, developed severe symptoms, had to be hospitalized, and as a result, because of that, can you hear me?
Yes, I can, sir. Yes, I can.
So because of that, he was hospitalized and unfortunately passed away when he was put on a ventilator. So the severity was more, even in the same house where both of them were staying in the same room. The reason for that may be, now you can only postulate it. There is no such evidence about it as yet because this is a very new condition. We don't know much about it, but maybe the husband had more comorbid conditions. He was hypertensive and he had cardiovascular disease. He was on drugs and the wife was not having any comorbid conditions. So probably that is the reason that it was not so severe in her case. That means that the women may be even younger when they are getting it, and it may not be in the same elderly age group that you are seeing the difference. The difference may be that the women getting it are in the younger group. They're having more immunity, but at the moment there's still just postulation about it. But definitely it is being seen that it is more common amongst the male counterparts as compared to the females.
Female count. Sir, I just want to take this opportunity to ask you that we have this trend being seen that younger people are getting heart attacks. So, what
Younger
is the
people
reason
are?
behind having heart attacks,
Uh-huh.
or having such conditions? So, what are the reasons that you can actually attribute to?
You see, basically, our heart attacks are coming at a much younger age group as compared to the Western population. And probably the reasons for that are that they are now the individuals are exercising much less. They are eating unhealthy food. Unfortunately, they are still smokers, more of them in that age group now, and they are taking other forms of smoking, like they are having shisha or gutka or things like that. Less physically active, less healthy diet, that is important, and they are ingesting more calories. Their weight is higher. If you look at the Western population, you will find that most of them have a very appropriate body mass index. And then in our population, the incidence of diabetes is increasing at a younger age group. And unfortunately, our HDL is much less. We have another constituent of fat, which are the triglycerides, which are on the higher side. We have what is known as a cardiometabolic syndrome. And this is occurring in the younger population. Then there are individuals who are under very stressful conditions. So all these factors, the environment, the genetic making of these people, younger individuals, and their lifestyle, it is all contributing to the increased incidence of cardiovascular disease. And I showed you two examples where an economic crisis in Cuba and in Poland resulted during that period in the reduction of the cardiovascular disease. So I feel that when our present government says that we are actually going through an economic crunch, this is the time actually to tighten our belts. And if we do that, we are definitely going to reduce the incidence of cardiovascular disease. We'll become more productive. Whatever we are eating, actually, most of it we don't need. So what we need to do is to reduce the intake also. You see, nowadays what has been shown is a concept of autophagy, which means eating your own self. the cells of the body, they are continuously undergoing make and break. Debris is being formed. By nature, this debris is being recycled. And when it is being recycled, the body is rejuvenated. So that is why it is being said that intermittent fasting is good for health. So I think now, in the month of Ramadan, you will find that this will do us a lot of good. It is a complete overhauling of the body. The only thing I advise to my patients is that from number one, when they are fasting, they should not end it up with feasting. It is extremely important. And then from dawn to dusk, they fast. From morning till evening, they are fasting, but from evening till morning, they should increase the intake of fluids according to the advice of their doctor. Because in those patients who have heart failure, they should have a restricted amount of water. Otherwise, water should be taken freely after they have actually, the fasting time is over.
And with that, we have actually reached the very end of our session. Thank you, Dr. Shahbaz, for taking time out of your busy schedule and guiding us through your knowledge. I hope the listeners have also enjoyed the session as well. Thank you once again, sir. Thank you.
Thank you very much, Dr. Saiba. It's a pleasure talking to you and to everybody on this webinar.
Thank you, sir.
Thank them all.
Allah Hafiz.